Great news for you folks. It's Acne Awareness Month. How about that? Fighting something that may not have disappeared after high school. A lot of folks still have it. Apex Skin's Dr. Alexa Stecker is here in the studio. I thought that is every month.
Yes, it is. Well, thank you for
right?
having me. For some people, it is every month.
Okay, so you've got the perfect skin. I bet you can help us and give us some ideas here, Doc.
Well, thank you. Yes, so many Americans of all ages really suffer with acne.
All ages?
Yes. At Apex, we're here to help you treat acne. We did bring several of our medical grade products here with us today. So we have our Apex Acne Foaming Face Wash, our Zit Zapper, which contains benzoyl peroxide, and also some of our AM acne pads. Okay,
so it sounds like in the very beginning we're trying to prevent this situation. So you say people of all ages. Why people of all ages, and what causes it?
So acne is caused by a combination of factors, but we do know that there is a hormonal role in acne.
So that's why young people.
Yes, young people, especially adolescents, is kind of when you first start to notice acne. But really, again, all ages can get acne, so it starts off by overproduction of oil from the sebaceous glands. So usually on the face, chest, back, shoulders, where we commonly see those acne bumps. But they can kind of occur anywhere on the body, actually.
You know, and it's unsightly, you don't like it, but for some people it's a real psychological problem, isn't it?
Yes, absolutely. So that's why I really emphasize early treatment. So when you first kind of recognize that you're getting some acne bumps, some pimples, or even just whiteheads, blackheads, it's important to seek help from a dermatologist.
So each of those things can lead to acne?
Yes, so there are actually different forms of acne. So we have, usually it starts off as a blackhead or a whitehead, which we call an open or a closed comedone, and that could lead to what is commonly known as a pimple or a papule. And then it can advance into more cystic or nodular type acne as well.
Okay, so you mentioned some of the things here. So I would guess like this first thing helps prevent that problem, first what you're talking about.
Yeah, so we have the medical grade acne foaming face wash, and that contains salicylic acid and glycolic acid. So that's going to be your prevention from those whiteheads, blackheads from occurring.
Okay, somebody listening right now, they hear about this. Is it a good idea still to have a doctor and go to the doctor and keep track of this kind of stuff, or should people be, trying to do this themselves?
No, absolutely. Definitely a good idea to seek help from a dermatologist, go to the doctor, because there's so many products out there, so it can be misleading or confusing as to what you should use. And we can also offer prescription treatment, both topicals and orals for acne.
Yeah, so you wake up in the morning, all of a sudden you have a zit, or whatever you want to call it, right? You call the doctor right then, or is there something you can do to help yourself out and then get on the phone and call somebody?
Well, absolutely. So we do have the Zit Zapper, so you can put that on the individual zit. Right, correct. But if you wake up in the morning and you have a zit, it is a good idea to call
go back to bed.
Well, to call your dermatologist. We're here to help at Apex.
Yeah. So it's a good. So how big a deal is it, and how easy is it to get a appointment or a?
We offer same-day appointments, and we have 12.
No, nobody does that.
We do. We offer same-day appointments, and we have 12 locations, so we really try and make it convenient and easy for patients.
Okay. So don't self-diagnose. If you got a little bit of a problem, make sure your face is clean. But make sure you call and get an appointment.
Absolutely.
Okay. Can this lead to like worse things, like if you're trying to treat yourself, like scarring and that kind of problem?
Yeah, so acne in itself can lead to scarring, but certainly manipulating the acne bumps, picking can lead to scarring as well. We do have medical estheticians at Apex, and they are well trained in doing chemical peels, microneedling, and all things that can help with acne scarring as well. So we really offer a 360 approach.
So that's really something to think about out there, folks, because if you had a problem as a kid and you have some unsightly marks on your face, you really don't want them anymore, you don't like it, the doc can help you with that.
Absolutely.
Okay, Apex Skin, thank you very much.
Thank you for having me.
It's great to have you. And guess what? We have